This is Eye on Cancer, and we're here with Dr. Raja Mehdi, Pahrumph's only medical oncologist. And the diagnosis of cancer is a very fearful, scary set of words. When you have to deliver it, for me, you were very calm and very supportive. How do you draw that in yourself? How do you gauge your patient before you talk to them when there's that kind of a diagnosis? That peacefulness that you carry with you is very comforting to a patient, doctor. And how do you draw that?
It's a learned process.
Yes.
And the more you talk to patients, to people about their illness, and what role you can play in that, and the more clear you are, and the more clear you make it to the patient, more importantly,
Yes.
make them understand the situation for them.
Right.
So there is a doctor's perspective, which is what can I do, what kind of a medicine I'm going to use, what procedures I'm going to do. That's fine.
Mm-hmm.
You know that. So,
Yes.
you know, that's not what the patient is interested in the first meeting, right?
Yes.
The whole life is, as a person sees it, falling apart in front of
That's precisely
your
what it
eyes.
feels like, yes.
So what I have learned is you save the technicalities for a later visit, because
Okay.
the patient is not going to listen to you. I won't
Yes.
listen to anyone if they are telling me the technical jargons about their fancy procedure. I want to know what do I have and how does it relate, how my life is going to be affected,
Yes.
how my family is going to be affected.
Yes.
And it's not very hard if you just talk to them as a human being.
Yeah, exactly.
That's it.
Exactly.
I mean, your knowledge set is fine as a
Yes.
doctor, but right now, you need to go with the patient's pace. So you cannot just blurb out everything that you know,
Right.
which generally is going to be more than your patient.
Yes.
And that could be for any illness. You need to go at the patient's pace. You need to understand their family dynamics more so than most of the doctors. Patients are not coming to an oncologist to treat a flu or a cold. You have to know what the patient's whole life situation is, because it's going to potentially change.
Exactly.
Sometimes for the short course, say, like I was quoting the numbers for stage 2 or 3 breast cancer. Say for stage 2 breast cancer, with treatment, if your survival is going to be 90+%, most likely you're going to be fine.
Right.
5 years down the road, there is some hardship, as you went through,
Yes.
with chemotherapy.
Yes.
But you are an example that you're alive and well.
Yes.
And we are talking about your cancer in the past, which is such a good thing.
Yes, it is.
So for that to happen when you're diagnosed, a patient does not know which side they're going to fall.
Right.
So that's why I say these stages are confusing.
Yes.
What the patient needs to know is, am I gonna beat this or get better, and what is it gonna require of me and my family
Yes.
to do that?
Exactly, and that brings
Your
us to-
schedules, your life, the
Yes.
hardship through that. What kind of a lifestyle changes will I need to make logistically for me and for my family? Those are the important things that you need to understand.
Right.
and then address it at the patient's pace.
And it also gives the patient something to do.
Sure.
That's
Sure.
you find that you have a mission. You identify with the doctor exactly what it is, and then you go on the mission to defeat the cancer.
So,
Right.
I mean, that's very, I hear this quite common that, medical oncologists, they are overly optimistic. They paint a rosy picture when the patient comes in. We are, if you're 2-3 years out of training, you're more realistic. We don't just stop doing everything when we hear the word cancer. We need to enable the patient to deal with it.
Yes.
If we start sort of mourning the diagnosis already, neither the patient nor I have control over what has happened.
Yes.
So my job is not to contemplate and look back on what could I have done differently, to do this. Maybe I shouldn't have smoked. Maybe I shouldn't have done this. Maybe I shouldn't have done this. You need to bring the patient out of this self-blame, because that's not going to do good to anyone.
Exactly.
Okay.
Exactly.
And do not be judgmental.
Yes.
You cannot be. That's the worst thing a doctor can do, is be judgmental towards their patient, in somehow blaming them of what has happened.
Exactly.
Taking responsibility for a future event is a different thing. Enabling them to make lifestyle changes that are going to better their health, absolutely.
Right.
But to be judgmental on what has happened from the point previous to when you know a person,
Right.
it is totally counterproductive.
Exactly.
So I'll try to avoid that.
And with that, what can a family do to support the cancer victim? And that pretty much is the same type of thing, I would think. Yeah.
I don't know if we'll have enough time to start that discussion in the. I know Patrick is prompting us for a break. So.
Okay. Well, in my experience, being able to find the information from you and form kind of like a team, and there never is an exact moment when the cancer, you can't kind of put your finger on, well, this is what I did, and it's just where we are now and where we're going to go. And
absolutely, I agree. And there is no unreasonable request or unreasonable question from a patient.
Exactly.
The doctor needs to understand where that question is coming from before making a judgment.
Got it. So it's time for a break, and stay tuned, we've got more.